So O&M Foundation is Obianuju Nina Media Foundation. It's an NGO that is committed to advancing health, mental well-being, nutrition, education, and gender advocacy across Africa. We are dedicated to creating sustainable pathways for women, children, and undeserved communities to thrive by addressing critical gaps in healthcare, economic opportunities, and empowerment. We believe that women's health, education, and empowerment through every stage of life are powerful catalysts for social and economic transformation, shaping stronger families, communities, and nations. So our key initiatives, we have 4 major focus, and they are healthcare, nutrition, education, and economic strengthening. So CARNAMED is one of our partners, and they are the reason for this session today. And so I want to give a brief intro of what they are also about. CARNAMED clinics are day clinics operating as outpatient medical facilities across different locations. They provide quick, affordable, and quality primary healthcare services to the population. They also focus and they utilize the state-of-art technologies. They adopt modern practices. They have a modern team. They provide top-notch services like medical care, emergencies to patients, and they also offer home care services, health assessment, general consultation, family planning, immunization, urgent care, diagnostics, pharmacy, and occupational health care. So today I have our guest speaker with us today, Dr. Praise Nwabuife. He's a renowned general practitioner with more than 10 years of clinical experience and leadership. He is highly passionate about optimal patient care, delivery, and wellness. He's also a graduate of Maduna University, Elele River State, with certifications in leadership and management, in health projects, and amongst others also. His experience cuts across surgical and internal medicine, pediatric and obstetric gynecology practice, with emergency care being an area he has poured himself so much into. So he also, I think with his training too in human relationship management, he has been able to navigate the medical space with empathy and professionalism. His flair for quality healthcare maximization, in his medical journey has taken him across the globe, and he's currently practicing in the Middle East, Saudi Arabia to be precise. And he's also contributing his quota of excellence to the sector. So we're very honored to have him here with us today. I want everyone to please join me in welcoming Dr. Praise Nwabuife as he takes over today's session. You're welcome, sir.
Thank you. Thank you so much. Thank you very much. Thank you so much for the warm welcome. Good
Thank
afternoon,
you.
everyone. I hope you can hear me.
Yes, sir, we can hear you.
Yes, we can.
Okay. Okay, thank you. After I'll proceed to share my screen so we can jump right in. And if you can see my screen, please do let me know. Okay. Can we see my screen, please? Hello.
Yes, sir, we can see your
Can we?
screen.
Oh, beautiful. Beautiful. All right. So, without much ado, let me say first of all, thank you to the organizers and the team that had brought this opportunity. And its topic is reproductive cancer prevention, right? I know we have all heard about cancers. We have probably known someone or heard of someone or read about someone who has suffered from cancer, and of course of various types. So I'm sure we already have some of sort of knowledge about cancers. So today we're going to be zeroing into reproductive cancers and to see. And cancers on its own, and reproductive cancers on their own is a very wide range of topics to delve into. But today we're going to be focusing on prevention. So we're not going to do much of the clinical presentations, the staging, the treatment, and all that. We may not do much on that. Today is just focused, tailor-made towards prevention and how we can be able to build a better life. I think a wise man once said, prevention is better than cure. So if we're able to achieve success in preventing some of these diseases, they will not have the worries to be battling with the cure. Okay. So we're just going to run through a couple of information, and I'll trust God to be able to enlighten us or share more lights on the, the experience that some of our friends, families, relatives, or loved ones, or people we know about, probably just on the media, have gone through, and how we can be able to prevent this for ourselves. Okay. So we're looking at the following outlines: introduction, types of reproductive cancers, gynecological cancers, field pathogenesis or risk factors, prevention, and we would delve a little bit into HPV vaccines. All right, so by way of introduction, reproductive cancers can be referred to as a spectrum of cancers related to the organs of the reproductive system. So by this definition, you can already see that we're not just dealing with gynecological cancers or cancers related to the female reproductive system. Reproductive cancers encompasses both female and male cancers. Can we hear me clearly?
Yes, sir, I can hear you from my end.
Oh, beautiful, beautiful. Thank you. By the right hand side of my slide, which should probably be on your left, or if you of the slide, you would see a diagram of cells, irregularly ugly looking cells. That gives you a mental picture of what the cancer cell looks like. You can see the edges are rough, they're not smooth, it's not beautiful, it's not. So that tells you there's nothing beautiful about cancer. Okay, there's nothing amazing about cancer. There's nothing beautiful to know about cancer. So cancer, we've said, is a disease condition in which some group of body cells grow in an uncontrollable fashion, defiant to the body's autoregulatory system. Now, let me explain this a little bit. You know, it's been said a nation without a government is bound to, to derail into anarchy. Is that correct? Now, so what does the government do? The government is like a regulatory system. I would love a feedback, at least, so I'll know if I'm still with us or if I've lost you guys. Okay. So once in a while, I'll just see me asking for feedbacks. Please just unmute and just respond. Okay. It makes me understand that we're together. One of the limitations of the virtual space is you may not know when you're lost, in the wilderness. So, thank you so much. Now, so I was saying
Thank you, sir.
that. Thank you. So I was saying that a nation without a government, right, is said to soon derail into anarchy. Why? Because what does the government do? They provide some regulatory systems, right, from the legislatures to the executives to the judiciary, whatever arm of government it is. They provide some certain form of orderliness or control. So the body also, God has built some systems or structures in the body that helps to regulate the way cells proliferate. When I mean proliferate, I mean the way they grow and increase in size. We are grown adults today because our cells proliferated, they increase in number and size, so to say. So when this control is altered, when this control is damaged, cells can now begin to proliferate in an uncontrolled fashion, and that most times leads to the generation of cancers. So we said, now these cells, and when this happens, these cancerous cells can invade. Normally, we have in our homes, we have homes aligned, laid up in streets. Each home or each compound, so to say, is separated by a fence. If we look at the Nigerian setting, most houses are separated from others by build blocks, which we could refer to as fences. Now, what do these do? They prevent what is happening from your house from spilling into what's happening in another person's house. Is that correct? Now, so we have this same system of separation in the body structure. Now, but something happens in these cancerous cells. What they do is they don't just grow beyond themselves; they also invade other structures. I say you can imagine if you're having a private conversation in your house and somebody, your neighbor is just eavesdropping into that conversation just at will. You can imagine what that does to your psychology, what it does to your privacy, right? It erodes or eats into your privacy. So we have, excuse me, so we have similar things happening um, in the body where cancerous cells can just proliferate and infiltrate, invade other cells and begin to cause damage. So that's one of the major problems with cancer cells. They don't just stay on their lane. They can attack other cells and cause much damage. Okay. So this is just that picture is just showing you the way they can progress. So we've talked about types of cancer, reproductive cancer. If we looked at the male reproductive cancers, we have the prostate cancer, testicular cancers, and then the penile cancers. And prostate cancer has been implicated to be second most common cause of cancer-related death in men. You see, with that, that means it's very, very devastating. With incidence rate in men that ranges from over 3%, of new cases per year. And we have per year, new cases per year. So we have these issues just devastating the lives of men. I've been, okay, being a doctor, I've met or have happened to take care of men who are probably well to do being damaged by these things, and it's quite disheartening. Okay, so we have testicular cancers, penile cancers, and I'm going to talk more about this prevention. When I get to the prevention slide, I will refer more to this. But because the emphasis was focused on female reproductive cancer cells, we would go there a little bit more. So types of female reproductive cancers, we've seen breast cancer, where we have breast cancer, which is cancer related to the breast. We have endometrial cancer. Endometrial cancers are cancers. You can see the slide, the picture by the side gives you an if just a picture, a mental picture of what the female reproductive system looks like. If you can see the slide, you have two pictures by the side, um, showing you the ovary, the uterus, which we call the womb in layman's term. Can you hear me?
Yes, sir, we
Can we
can
hear
hear
me,
you.
please? And you can see the slide?
Yes, sir. It's visible.
Okay. All right, great.
You can see
Yes,
the
sir.
slide. Sorry, Dr. Praise, can you put it on
Yes,
slideshow?
please. Let's
Can
see
you
if
put
I
it on
can do that.
slideshow? Okay, thank you.
Okay. Is it better now?
Yeah, here it is.
Okay. Just a minute. Just a minute, sorry. Just a second, sorry. I think I'm having some. Just a minute. Just a second, sorry. I'm trying to get back to where we were. The slide had gone beyond. Okay. How about um Dr. Adeze, I don't know, you may permit me to go with this. The slideshow is taking us to the end of the page and it's not allowing me navigate back. Let's
Okay,
see.
so that's
So,
fine. Thank you.
let's do. All right. It's taking me to the end of the page and it's not allowing me navigate to my current slide. Okay. So, I would definitely send this slide across so that we can have it if we need. So, back to what we're saying. So we have endometrial cancers, we have fallopian tube cancer. Fallopian tube is that tube that transports the egg from the ovary down to the womb for fertilization and implantation. So we have cervical cancers, we have ovarian cancers. Cervical cancers are cancers that affect the cervix of the uterus, which is the lower third of the uterus. You see. So we also have the vulvar cancers, ovarian cancers, which affects the ovaries, vulvar cancers, and the vaginal cancers. So you see, we have a barrage, a wide range of areas that can be affected by these cancer cells in the female. Okay, so now let's look at the epidemiology of gynecological cancers, the spread. So in August 2014, PubMed released the publication of a 2022 data that showed about 1,407,000. Please pay attention to these statistics. About 1,473,427 new cases of gynecological cancers per year. Now, this was as of 2022. That means roughly about 30 women in every 100,000 women would come down with or came down with a one form of gynecological cancer. So you see the burden is quite high. It's in the neighborhood. You see. So the earlier we begin to pay attention to these cancers and see how we can prevent them, I think it's better for our overall health. If you look at the same slide, says about 680,372 deaths occurred in 2022 from gynecological cancer. Excuse me. Now let's look at each standardized incidence. We have about 50 per 100,000 persons in East Africa, 50 per 100,000 persons, 17.1 per 100,000 persons in Northern Africa, and you have about 26.2 per 100,000 persons in Nigeria. So it's like I said, it's in the neighborhood, it's everywhere. So the earlier we are aware of it and take steps to mitigate its spread, I think it will be the better for us. So let's look at cervical cancer. We said it's by far the most common and most deadly gynecological cancer amongst women. Its prevalence is low. Its prevalence is more in the low-income countries, like we've seen. The third world, what we refer to as third world, they don't more use that terminology anymore. But let's use the low-income countries. Its prevalence is more. So if you look at the slides by the side, you see on that slide, you see an area that is marked with something close to a whitish stain on that close to the cervix. I wish I could. But are we seeing what I'm saying? So I know we're together. Can we see on the diagram there, can you see the whitish patch on the uterus, on the diagram of the uterus?
Yes, sir, it's visible.
Beautiful. So that's showing us a picture of a cancerous cervix. You can see it's not something beautiful to behold. So now we said it's by far the most common and the most deadly of all gynecological cancers, and its prevalence is more in the low-income areas, partly due to limited access to vaccines, which we're going to be discussing in detail towards the end of this conversation. So it's more partly due to the limited access to vaccines and the increase in prevalence of infections, ranging from HIV infections, HPV infections, to all sorts of STIs, so to say. So now, what is the exact cause of this cancer? Now, what is the exact cause of this cancer? It's been documented that the exact cause of these cancers are unknown. However, there are some factors, or what we call risk factors or predisposing factors to this. So we're just going to look at it. There's a diagram there that gives us a clear picture on some of these predisposing factors. And one of the theories that have been put together is that it's been noticed that most people that come down with cancer, there's been a genetic change or mutation in the genetic composition of their cells. So the cell, instead of following through the normal genetic instructions, there's a change or there's a mutation and they begin to do otherwise. And so what are the common factors that could lead to this change or mutation? That's what we have on our slide. Hereditary factors. Some persons are born with already a genetically mutated gene, right? They are born with a gene that is mutated, that is distorted, you see. So over time, they could eventually come down with uncontrolled proliferation, which we call referred to as cancer. Then we also have UV radiations. People being exposed to unchecked amount of radiations. You see, it's been said that most people who are in war reading zones, areas that are reading with wars and the rest of them, because of the release of radiation from these missiles and instruments of war, they are predisposed to come down with cancers. It's because this radiation distorts the genetic um, um, documentation or programming, you see, and predisposes such a person to cancers and the rest of them. We also have chemicals, harmful chemicals, viruses. We'll look at this, for instance, the human papilloma virus, which is commonly referred to as HPV, even the HIV virus. You see, hepatitis B virus in cases of digestive cancers and the rest of them. So viruses have been implicated because one of the reasons is because viruses go to attack the genome. They go to the membrane's genome directly to go and cause their problems and attack. Malaria could attack your red blood cells and it's fine. Virus is aiming for your gene itself. Most viruses. Do you understand? That's how we have DNA viruses, RNA viruses. They're going to the genetic component. So that's on an aside. All right. Now we also have smoking as one of the causes. So we're going to see them in details. Now, like I said, the exact cause of reproductive cancer is largely unknown. However, some research has proven or has shown that some sort of factors are responsible. We've listed some of them: genetics, multiple sexual partners. Let me stay here a little bit. Now, we've mentioned that viruses, right, infections are some of the things that predisposes to these cancers. Some of these cancers are brought about by infections, viruses we've mentioned. So multiple sexual partners, you're exposing yourself to possibly contacting these viruses. Infections with human papilloma virus we've mentioned, which we're going to see playing a key role in penile cancers, cervical cancers, and most other gynecological cancers, right? So infections with HIV and other sexually transmitted infections, what they do, what these do is that other than causing a mutation in the genome, they reduce the immunity of such a person. And when such immunity is reduced, the ability to checkmate this uncontrolled proliferation is reduced, and just cells just go wild. Now, we also have high risk sexual partners. Someone may be faithful, but his partner is high risk. His partner has multiple sexual partners. So that such a person is referred to as a high risk sexual partner. So we have cigarette smoking. Cigarette smoking has been implicated in most cancers, not just reproductive cancers, all the way to lung cancers and liver cancers and the rest of them. So long-term use of contraceptives. Long-term use of contraceptives, this is very implicative in endometrial cancer, though protective for ovarian cancer. So we're going to see how this will come to prevention. Okay. Then low parity. Low parity. You have a woman who is 50, 45, she doesn't have a child, she's not been pregnant. That kind of a person can be predisposed, but it's not sacrosanct. It's not to say all 50-year-old women without children will come down with cancer, no. But it's a risk factor. Early menarche. Early menarche is a woman who starts her menses very early. You know, I know menarche has been brought down to 8, 9 years in ladies. So someone having sorry, puberty, that's puberty, sorry. Menarche has been dropped down to, and we've also had, yes. We also had documentation of 9-year-olds having their menstruation. Yes, sir. So when we have early menarche coming all the way down, so this can predispose. Menopause, late menopause, prolonged use of ovulation inducers, obesity, diabetes, and some hormone replacement therapy. So I know time is already going so fast. So let me come down to prevention. This is where we would, because this is what this conversation is about. How do we prevent these cancers? So now let's look at prevention. Now, prevention, Let's skip, don't worry, skip the HPV vaccine as you're seen as number one. Let's go to screening. Now, how do we prevent this cancer? Let's start from breast cancer. How do we prevent the occurrence of breast cancer? It starts from regular examination. You see, it's been said that every adolescent, every pubertal female should be taught on self-examination of her breast. How do you examine your breast? You're having your bath in the morning while you're scrubbing your breast, you feel something abnormal. It's been said that women should be able to touch their breast. There's nothing wrong with that. You should be able to examine your breast. So you know what normal breast tissue should look like or should feel like. So while you're having your bath, you're examining and you feel something abnormal from the usual, you should be able to know that something is wrong here. I need to take steps. So it starts from breast examination, self breast examination. If you don't know how to examine your breast, I would encourage us to go watch a YouTube video on breast examination, self breast examination, so you can be able to understand how to do it. Now, I understand this lecture or presentation doesn't give us that space to be able to delve into other things because of the time. So I would encourage us to get to see a video that will teach us or help us understand how to do self-examination. So breast examination is one. For ladies that are less than 45 years, you can do a regular breast scan, especially if you notice that you found a lump that is or something that is abnormal, or you have a family history, close family history of a breast cancer. It will be advisable to once in a while do a breast scan. Then for ladies above 45 years, you can do what we call a mammogram, which is another form, of breast examination. So we also talked about pap smear. We'll go in details into that. Tumor markers, screening for tumor markers. Now, there are things in the blood that we can identify. And so with this presence of this person is at risk of developing a tumor or a cancer. That's what we call tumor markers. One of it is CA125. There are several ones. There's also the BRCA1 gene, BRCA2 genes. Those are genes that or markers that could predispose, that could point your attention to that. So we said that early detection and treatment of pre-malignant conditions. We will talk more about when we go to pap smear. Okay, use of oral contraceptives to prevent ovarian cancers. I mentioned that we were speaking earlier. Combined estrogen progestin pills reduces the risk of endometrial cancer. Someone who is at the risk of endometrial cancer, not been married before or not had a child before, at the risk of it, and there's a family history of it, use of combined estrogen progesterone pills can help reduce this risk of endometrial cancers. For very high risk individuals, early parity is advised, like getting married, giving birth early enough is advised. And in some cases, we can do what we call prophylactic excision of the organs. For instance, we all know about, most of us know about Angelina Jolie, the famous movie star who had a very close family history of breast cancer. And after she felt she was done, she was done with her giving birth. She went and took off the breast, so to say. And what's the essence of that? To prevent issues from happening. And that's what someone says an extreme preventive measure, but it's also a preventive measure. If there's no breast, there's no organ to talk, there's no space to talk about breast cancer. You see, that's an extreme preventive measure, but it's one of the preventive measures that could be taken. So let's zero in. We mentioned HPV vaccine at first. So let's zero into HPV vaccine. And I'm happy, whilst the speaker was speaking, she mentioned about CARNAMED clinics being one of the supporters of the organization, and they are involved in several medical practice or providing several medical care. One of the things we're going to be talking about is HPV vaccines. Now, HPV vaccine is recommended for women of reproductive age group. Women of reproductive age group, people will say from age 12 to 26. I think in the US, they brought it down to age 11 or even down to age 9, you see, because of course, like I said before, puberty has come, the age of puberty has stepped down to age 8 and 9, you see. So ages of reproductive age group from age 12 to 26, or you can say from age 9. Now, these vaccines, what do? They help to prevent against infections from HPV vaccine. Let me put a disclaimer here. Sometimes someone can get randomly infected with HPV and the body takes care of it. But HPV vaccine is targeted to help reduce the ability of this organism to produce a cancer. And like we saw in cervical cancer, HPV virus is very much associated with those cancers. So HPV vaccines helps to prevent such infections from occurring. And let's look at the subtypes of HPV vaccines. We have the bivalent, which covers now this human papilloma virus has a wide strain. What do I mean strain? There are several types of the HPV virus. There's type 11, type 6, type 18, type they've been listed there, type 6, 11, 16, 18, and all that. So the bivalent just protects against two, you see. So if it protects against two, that means that person can be exposed to others, infections by others, right? We also have the quadrivalent, which is the Gardasil. That prevents against four subtypes, the 6, the 11, 16, and the 18. This just protects against genital warts, cervical cancer. So there are other range of HPV virus. So the American Society has suggested and has advised that if you should get vaccinated if you're a woman within the reproductive age group. And if you are to get vaccinated with HPV vaccine, you should go for the non-valent, or which is also referred to as the Gardasil 9. Now, the beauty about this Gardasil 9 is that it covers all the wide strain of this human papilloma virus. So if it is 11 strain that the person is attacked with, the person is covered. If it's the 52nd strain or strain 52 that such a person is attacked with, the person is covered. And one good thing, I think I was having a conversation with CARNAMED, and I think the CARNAMED hospital, CARNAMED clinics, they provide you these vaccines. You're able to have contact with these vaccines even at a very affordable cost. So you can, if you're a woman or a lady, you're living around the Lagos environment, I would strongly suggest find a time to stroll to the clinic and then discuss with the clinic, the doctors, and then avail yourself these vaccines. They have the Gardasil 9 that provides protection over the wide range of HPV strains, and it prevents all forms of cancers from cervical cancer, oropharyngeal cancer, anal cancer, vaginal cancer, vulvar cancer, penile cancer. Even if you're a man, it also, yes. I know most times when we hear HPV vaccines, we think, oh, this is just for women, it's just for women of reproductive age group. No. Also for men with penile cancers, testicular cancers, I mentioned, especially the penile cancers, HPV vaccine protects protects men from such cancers. And we mentioned, let me say, as I conclude, it's noteworthy to understand that the preferred subtype is the non-valent, which is Gardasil 9, which I mentioned earlier. So I talked about pap smear when I was speaking earlier. Pap smear is a medical procedure where some tissues are scooped out from the cervix of the woman. Now let's go back to the previous slide. Okay, now look at this slide. You see the one talking about cervical cancer. You see that white patch on that lower part. That's the cervix. So some tissues or scrapings are scooped out of that area and taken to the lab and investigated, checked for possibilities of cancer cells developing. That's pap smear. Now it's done every 3 to 5 years. Every 3 to 5 years. If the person is infected with HPV virus, you do a more rigorous examination or do a more rigorous smear check. Now, it's been said that from women within 21 years to age 55 should have this check regularly. After age 55, the chances are very slim that the woman can come down with cervical cancer because atrophy has set in. So from age 55, you can be able to leave that. But from within age 21 to age 55, it's advised that every 3 to 5 years, women of reproductive age should have pap smear done. And I also understand that CARNAMED also provides this service for pap smear examinations where you can come into the hospital, the samples are taken to the lab, and you run a check and be sure that you're healthy. Like I said in the beginning of this conversation, to prevent these disease conditions is better than cure. As we speak now, there's been no excellent cure to cancers. As well, male cancers are treatable. Testicular cancers, prostatic cancers, most of some of these cancers can be treatable. We can take off especially if diagnosed very early, take off the affected organ, you know. But most times, cancers, when they present in the late situation, they're very late setting, it's almost very difficult to cure. So the best way to prevent it is take into cognizance these steps we've talked about: lifestyle modification, especially vaccinations. We've talked about the HPV vaccines. We've talked about the regular check, the breast examination, the pap smear test, which you do every 3 to 5 years to ensure that you are in good state of health as you pursue your dreams and pursue your life's goal. So, like I mentioned earlier, you can feel free to visit. I'm sure the organizers of this program will be able to give you more information on that. Feel free to visit the CARNAMED clinic and avail yourself with these vaccines and all form of testing for the males. I'm sure some males here will be saying, this guy didn't talk about prevention for male cancer. So prevention of male cancer, I talked about HPV vaccines, also preventing penile cancers. Then for the males, let's have a regular PSA check. PSA is a prostate specific antigen. When that particular marker is checked in the lab and you're having values that are away from the normal, greater than the normal should be 0 to 4. We start having values greater than 10. You can start raising eyebrow that something is wrong. We need to check your prostate. Or you're having issues with urination, you're having difficulty urination, that gets you to the hospital, and those samples are checked. So, what am I saying in a nutshell? In summary, cancers are real. Reproductive cancers range top one of the top causes of death. Prostatic cancer being the second leading cause of death in males, cervical cancer being the most deadly cause of reproductive cancers in females. So they're very common. They are within. The best way to treat or to cure them is to prevent them. And one of the ways to prevent them is to prevent HPV virus, the human papilloma virus. Do a regular pap smear and do a regular pap smear check, do a regular breast examination, so we can be able to detect these things early and treat them. So thank you so much. I believe we've been able to get an insight into reproductive cancers, a broad spectrum insight, and how we can be able to prevent them. And I've also, because of this, I've suggested to us that several places where you can have this vaccines done and test. And one of the places I've suggested to us is the place I was mentioned earlier by the moderator, which is CARNAMED Hospital. And we can be able to get these vaccines and these tests done to ensure you stay healthy. So thank you so much for your time. Thank you for listening. I hope you're able to gain one or two things during the presentation. Thank you. So I'm going to stop sharing my screen now and hand it back to the moderator. Thank you. Can you hear
Thank
me?
you so much, Dr. Praise.
Okay.
Thank you. I really gained value too from everything you really said. And for our listeners, I don't know if you have any questions, can you just drop it in the chat box, or you can turn on your microphone and ask Dr. Praise.
Good afternoon.
Okay.
Good afternoon.
Good afternoon, ma'am.
Oh, yeah, my name is Catherine. So thank you, Dr. Owabife, for that session. That was very insightful, although I didn't completely stay all through. Like in between, I was getting things done. So, but at least the little I got, I would like to ask if I do the pap smear and they find out that let me not use myself. If somebody does a pap smear and it's maybe a little of maybe this the growing stage, maybe it hasn't gotten to the complicated part or stage, and something like that is detected, right? Can the vaccine still work? at that growing stage of the cancer, probably this, yeah, the cervix, yeah. Can the vaccine
Okay,
still
thank
work?
you.
Thank
Okay.
you.
Thank you so much. Thank you so much for the question. So it tells me that at least you were following, you were listening. Okay. All right. So now, like I mentioned, the vaccine is to help you prevent these cancers from occurring. Okay. So once you do a pap smear, and then is found out, you discover that you already have this cancer growing, this cancer cells. Someone already has this cancer cells growing. The proliferations have started. This cancer cells are started growing. Now, at that point, we've gone beyond prevention now. So we've gone to the level of treatment. Are we together? So once these cancer cells are developed, we've already moved past the level of prevention. So we've entered the level of treatment. So are there treatment modalities for early stages of cervical cancers? Very correct. Modalities that can even eradicate that process. For instance, this segment of the cancer, depending on how far it has progressed, the segment of the cervix can be excised and followed up with the chemotherapy or radiotherapy, depending on what the histology says. All right, the entire uterus can even be taken out, followed by radiotherapy or chemotherapy, depending on the results of the histology and what the susceptibility is. Okay, so once we already have the metaplasia taking place, that's this cancer has already formed, and you can see evidence of cancer cells already. Now, so we've moved past prevention, we've entered treatment, and there are treatment modalities, especially if found very early. You can almost rest assured that you could achieve a cure. Is that okay? Did we get it? The person that asked the question, did you hear me?
Yes, sir. Yes, sir.
Okay, great.
Okay. Mm, Thank you so much. I have one last question, right?
Please go ahead.
So for the breast cancer, for the
Yes,
breast
please.
cancer, if um if we self-examine ourselves and we don't find any or don't feel anything, um I don't know, is it possible? I don't know how to ask this question. Is it possible for us to detect truly that by mere touching we are free or we have something like that?
Oh, great. Thank you. Thank you so much for the question. Very beautiful and brilliant question. So that brings me back to what I said earlier when I talked about the breast. I said you can do a breast ultrasound, which CANAMED can avail you. You can also do a mammogram when you're for those ladies older than 45. Now, so if there's a high risk, if there's a family history, a you have a relative, maybe second generation relative or thereabouts that has a history of a breast cancer. Now, so you may not necessarily rely on breast examination alone because you may not even be able to pick some subtle lumps. So going for a regular ultrasound, breast scan, if you have a history of that, is very, very important. And then for those ladies over 45, have a mammogram done, okay? And let's say you are just a random person, no history of cancer, no history of breast cancer, and all that. You do your breast examination, and you are not sure whether you got a lump or you didn't get a lump. Come to the hospital. The doctor would examine you, and you can have a breast scan done. Okay, so with the breast scan, even if you miss it on your own, probably while you do your self examination, you miss it. With the breast scan, it will be picked up. You get it, and so you can be advised on the next step to take. Do you
Okay, thank you
understand?
so much. Yes, I do. I
You're
do.
welcome.
Thank you so
You're
much for
welcome.
that.
You're welcome.
Okay, thank you so much, Catherine, for your questions. Doctor, I also have a question.
Please go
And
ahead.
okay, my question is there a best time of the month for women to do that breast self-check? Is there a best time for that?
All right. Now, you can do your breast examination anytime. There's no best time or safest time or best time for it. I know some persons will say probably during the ovulatory period and all that, but that can be misleading because during the ovulatory period, normally your breast is preparing itself telling itself you're going to get pregnant very soon. So your breast is preparing for a child to breastfeed a child, and at that point in time, the breast. That's what you notice. I don't know if that happens to you, but some ladies during their ovulatory period, during their menstruation period, they notice their breast is full. They feel this fullness. So if you're doing the breast examination at that point, it can be misleading in the sense that the full breast may feel like a lump. The breast lobe that is engorged may feel like a lump. Do you see? And you could now think, oh, I have a breast cancer. Oh no, you don't. It's just irregular changes that occur during ovulation, menstruation, and the rest, during a menstrual cycle and the rest of them. So now there's no preferred time or set time for breast examination. Have your examination as regularly as possible. You have your bath every day. Nothing stops you whilst you're having your body check. Or at least once a month, twice a month, you just run a check on you don't need to pay anyone to do so. There's no preferred time. Okay?
Okay. Thank you, sir.
You're welcome.
Okay. So I don't know if there's any question among the audience. If there's any question you can ask. Okay.
Okay, good afternoon, everyone,
Good afternoon.
and good afternoon, Mr. Praise. First of all, I just want to really commend your presentation. It was very nice and impactful. I would say definitely we are 1% smarter and more enlightened on reproductive cancer. So I have a question. How can schools and university contribute to like better educational and awareness on these like cancers and diseases? Can you hear me?
Thank you very much. Yes, I can hear you. So thank you very much. That's another very beautiful question. Thank you so much. Is that Paloma? So, and thank you.
Yes,
All
sir.
right. So thank you. Now, the power of awareness. Most times we downplay the power of education, health education, awareness, and all that what it can do. Now, so how can schools, universities, secondary schools play a part in this? Because like you mentioned, while we were speaking, we said ladies of reproductive age group, we said from 12, some from 9, and you find the teenagers, early adolescents, you find them in secondary schools and universities. So what's the role of these schools? Now, to increase health education, all right. But once in a while, okay, we know some schools have the opportunity of having their medical clinic or their clinic, right, in campus or in school. Now, once in a while, engage your medical personnel to have a general health talk or health education where you educate these ladies, these students, teach them, help them to understand that it's not just about studying, reading your book. If you're not paying attention to your health, someone can graduate and illness cuts the person short. Do you see? So regular education, health education is important that we begin to push or advocate for more health education or health talk or sessions, even within our schools, right? Our universities. If for the schools that don't have health, have clinics or have doctors working with them, you can outsource. You can go to a clinic nearby or a hospital nearby that you can engage with the management and get their doctors to come once. You can do it once in 6 months, once in 3 months, once in a year, depending on the capacity of the school. And you get your students to come and they're taught, they're educated, their eyes are opened on how they can self-examine, how they can encourage their parents to take them for vaccines, and all that. It's been said that when you are knowledgeable, you make better choices. I think it's scripture that says, "My people perish for lack of knowledge." Lack of knowledge can be destructive. They say ignorance is no excuse. So one way we can improve the health of school children is by regular health education, getting not just the students, also the teachers to be involved in this process. Thank you.
Thank you very much, sir. Thank you.
You're welcome.
Okay, sir. Thank you so much. Thank you, Paloma, for your questions. Thank you very, very much. This was a very impactful session with you, Dr. Praise. And because of time, we'll be rounding off. I want to appreciate you,
All right,
Dr.
thank you
Praise, for
very
your
much.
presence.
Um, I would like to step in at this point. Thank you very
Oh,
much.
okay, thank you, sir. Thank you. Thank you very
And
much. Thank you for the time and the
hello,
knowledge you imparted us with.
hello,
Yes, I can
Rejoice.
hear you.
Yeah,
Yes, I
please.
can hear you.
I step in at this point in time. My name is Afolabi Adetola. I'm the managing director at CARNAMED.
Okay, sir.
Well, I'd like to thank everyone that has joined. This has been an extremely informative session, and I'd like to thank Dr. Praise for the excellent presentation that was made. We
My
actually set
pleasure.
webinar because we really wanted to promote education. And like you rightly said, our people perish because of lack of information. This is basically to also help people or to spread out the knowledge of some of the prevailing health conditions or some of the cases that we see, even especially from our business, CanaMed. CanaMed is part of the Cana Health Group. We're actually focused on clinic, diagnostic, and pharmacy. We operate a 12-hour day clinic, and our flagship hospital, our flagship clinic is located at number 137 Ogudu Road and in Lagos. And then we also have a sister company, Cana Diagnostic, also, which is also co-located with CanaMed, where we offer a wide range of diagnostic services around laboratory services, radiology services, and for CanaMed also, we run general practice, we run GP clinics and also have specialist clinic as well. I would also like Mr. Dr. Ohana Kawi is the clinical head for CanaMed to also talk about some of the initiatives and some of the exciting things that we're trying to do at CanaMed. And Dr. Ohanaka, over to you. Dr. Ohanaka, are you here? Okay, well, I don't think Dr. Ohanaka is there. Um, okay, well,
Hello, can you hear me? Sorry.
okay, yes, okay.
Sorry about that. Okay, yeah. So I'm Dr. Adeze, and yeah, we are CanaMed clinics, and we are bringing this just like our MD has spoken, because we want to create awareness and education concerning prevention. And so as a result, there are certain things we've decided to bring forth as a clinic to help and aid, to join forces with the government. For example, we know very well that HPV vaccine is now made compulsory in the immunization scheme for children, between the age of 9 and 14 years. But after that, most other people would have to pay. And most of the vaccines are actually like very costly. And just like Dr. Priest has said, HPV vaccine is like one of the major causes of cervical cancer. In fact, it's the major cause. All the variables, all the different types of the HPV virus, sorry, they're either causing warts or cervical cancer or penile cancer or anal cancer. So we can't actually say we are trying to give health education, and at the end of the day, there is nothing that is brought forth to help to compensate. So just like everyone has said, and we are actually giving, subsidized rates to have the HPV vaccine at CanaMed. So for every single person here, like has been said, it's both for men and for women. So we are giving at very, very discounted prices. That's, I can assure you that you probably won't get anywhere else. So that's like one of the packages we have. And then we also do breast scan. Yeah, so there's a package for every single person here. If you are here and you really want to plug into, having a vaccine or getting a scan done or a PSA test for the men, then we have like a package. So we have something for the breast scan, we have something for PSA for PSA testing for men, and also we have HPV vaccine and hepatitis B vaccine. Let's not forget that one of the things that was spoken about viruses, we talked about HIV virus and hepatitis B virus. I mean, Praise mentioned it's that these are actually predisposed to cancers too. So we also have a very good package, very good discounted prices for the hepatitis B vaccine, and you know that this is actually taking like 3 doses, both for the HPV and the hepatitis B. So yeah, these are some of the things CARNAMED is actually just doing to ensure that we subsidize on what, or we complement what the government is doing, because it's a global problem, and this is our way of contributing to making the world better, you know, us living healthier lives and preventing these cancers. So we would love to, you know, see as many people as you can, spread the word to family, friends, and, you know, as much as you can to tell them about what we're doing here, and hopefully we will all live healthy lives. Thank you. Okay, so I'm over to the moderator.
Hello. Hello, can everyone hear me?
Oh yeah, we can hear you.
Yes, yes, I can hear you.
All right. Thank you so much, everyone. We've come to the end of this session. Thank you to our partners, Dr. Praise, and to my boss, Ma'am Obianuju Asika. Thank you all, the audience as well, for being a part of this program. I want to say a very big thank you. We are very grateful, and we also hope to see you more in probably the informations that have been dropped here by the CARNAMED partners. And that's it. Thank you so much for joining in. Do have a wonderful day. Thank you.
Thank you.
All right.